Hello, my name is Kaitlyn. This presentation is for the purpose of learning and for Athabasca University's Faculty of Health Sciences course, Trends and Issues. I will be presenting to you the argument that provincial regulatory bodies for health professionals should not be replaced by national bodies for registration of these professionals. The agenda for this presentation is as follows. I will begin with a brief introduction about what provincial regulatory bodies are and the history of them in Canada. Helpful definitions for other terms used in this presentation will be reviewed. I will then present my arguments against this nationalization and finish with my concluding statement. So, what are regulatory bodies? Regulatory bodies for health professionals in Canada are organizations that were established to protect the public interest. These are also referred to as licensing boards or regulatory authorities. They are not educational institutions, although they're often also called colleges. They ensure regulated health professionals provide health services in a safe, professional, and ethical manner. This includes setting standards such as scope of practice, entry-level competencies, as well as addressing public complaints. These regulatory bodies are governed by a board consisting of professionals elected by their peers and members of the public appointed by the government. Regulatory bodies are also self-funded, so the members pay registration fees, and those fees are the source of income for the regulatory body. These professionals are also typically governed by provincial or territorial acts, either specific to their profession or broad ones such as the Regulated Health Professions Act of Ontario. This act grants professionals the ability to self-regulate and outlines things such as who can use a protected title, registration requirements, who is considered a patient, controlled acts, and registration requirements. It's up to the regulatory bodies to implement the regulations in the acts and ensure the members uphold these regulations. The history of these regulatory bodies in Canada began in the 19th century due to the need for medical regulation on a regional level. This was to address local healthcare needs, concerns, cultures, and traditions. And this resulted in collaboration between legislative, i.e., government bodies, and professional organizations to establish standards to meet these needs. Nursing in particular began in Canada with midwifery and Indigenous healers. When this care moved to institutions like hospitals, care was provided by staff who had a variety of skills and levels of pay. Nursing in hospitals eventually led to the development of training schools to elevate the status of hospitals who had these programs, which then led to standardization. Registration of nurses began in 1910 in Nova Scotia, and legislation in Canada to address this was established in all provinces by 1967, and then in the Yukon, Northwest Territories, and Nunavut between the 1970s and 1999. Registration began and remains provincial and territorial. Other definitions that will be helpful to understand during this debate include health professional. A health professional in this context is someone who is a member of the regulatory body for their chosen healthcare profession and considered a regulated healthcare provider per their provincial or territorial healthcare act. Which healthcare professions are regulated varies from one province or territory to the next. Healthcare, according to the Merriam-Webster Dictionary, is, quote, efforts made to maintain, restore, or promote someone's physical, mental, or emotional well-being, especially when performed by trained and licensed professionals. In Canada, this is federally funded, and although the federal government is responsible for establishing broad national healthcare standards, provinces and territories are responsible for the management, organization, and delivery of healthcare services for their residents. On the surface, it might seem appealing to have one national body for all healthcare professionals. However, there are several arguments against this amalgamation that I will present to you all now. Argument number 1, risk for inequities. Adams states that at one time some Canadian regulatory bodies, quote, regulated more than one profession, and sometimes structured social inequalities in practice became reproduced in regulation, where dominant professions had a greater voice and were regulated in a manner that subordinated others. This troubling past is reflected in Adams's 2022 study involving interviews of healthcare professionals regarding nationalization of healthcare regulatory bodies. Interviewees commonly expressed concern that nationalization would result in professional inequities. Many in the interviews reported that they would not have an issue amalgamating if they were the dominant group, which is concerning for history to repeat itself. Professional colleges may represent small groups of 100 people or more than 100,000. For example, the College of Dentists of Ontario has approximately 600 registrants, while the College of Nurses of Ontario reports approximately 124,000 registered nurses. This is a radical range of registrants. How can they and their patients both be represented fairly if healthcare providers are all regulated by one national body? Smaller groups may be forgotten when they are a small cog in a much larger machine. Even if registration was nationalized for each profession, there is a wide range of registrants per province or territory. As noted, Ontario has over 100,000 registered nurses, while PEI has 1,800. In Adams's 2022 study, those who regulated both small and large professional bodies admitted, quote, "For us to try and pay attention to fully support that small little subset of our membership we have to be very, very intentional about that. And so that's a problem." This issue of being possibly disregarded would be further exacerbated by the inevitability that there would be issues between groups regarding scopes of practice and overlap. This could result in outright conflict or a profession having less of a distinct professional identity. For example, there is increasing desire for hospitals to allow registered practical nurses to practice to their full scope. This may result in RNs feeling professionally threatened and suspecting that their jobs are in danger. Physicians are arguing against the use of nurse practitioners filling the gap in primary care, while nurse practitioner regulatory bodies are advocating for continued expanding scope to better provide primary care to these communities. With different healthcare professions vying for the same jobs and with expanding, changing, and overlapping scopes of practice to meet community needs, how can we expect them to work together in a cohesive nationalized regulatory body and have all professions regulated and represented fairly? Argument number 2, a one-size-fits-all approach. A national regulatory body might implement standardized regulations that do not reflect regional differences in healthcare needs, practices, and demographics. This could affect the ability of provinces to address specific local healthcare concerns. Regulatory bodies came about organically as a response to address local healthcare needs, concerns, cultures, and traditions. Canada is a vast nation, and regions within it require their healthcare professionals to meet these unique needs. For example, the College of Nurses of Ontario has established standards and guidelines, educational tools, and regulations, bylaws, and legislations in conjunction with provincial governmental bodies to meet the needs of the people in Ontario. These needs change over time, and the CNO works to ensure nurses in Ontario can meet these needs. For example, the colleges assess, collaborate on, and advocate for changes regarding scope of practice. Recently, in December 2023, the CNO and the Ontario Ministry of Health expanded the scope of practice for RNs to prescribe some medications, communicate diagnoses, with optional additional education. This was to meet the needs of the people in Ontario, and the project was developed in direct consultation with Ontario stakeholders, including the public. Areas of need were identified as long-term care, home, and community care. Not all provinces allow RN prescribing. Healthcare already takes up a large portion of government funding. There is not an unlimited pot of money to provide all services to everyone. Dividing healthcare by region allows care priorities to be determined and addressed for the unique population needs. It just makes sense. For example, Newfoundland and Labrador has the oldest population in Canada, and Nunavut has the youngest. These areas would have vastly different health priorities based on just this demographic alone. Regulatory bodies in these areas should also, therefore, be able to recognize and understand these needs and ensure standards of care and scope reflect the needs of these communities. A national body might also inadvertently favor certain professions or regions over others, leading to disparities in how healthcare professionals are regulated across the country. As noted, Ontario has a significantly high number of nurses to regulate. The population of Ontario is also quite large compared to many other provinces and territories. This may result in health inequity. Nationalizing regulatory bodies risks homogeneity and healthcare that doesn't reflect local or regional needs. Argument number 3, increased bureaucracy and inefficiency. I will admit, it is difficult to argue against a hypothetical. However, Australia went from a state-based regulatory body system to a national system for all healthcare providers. It's called the Australian Health Practitioner Regulation Agency. In this system, 15 national health profession boards, several governing more than one profession, exist, and their regulatory work is supported by an administrative body. Australia is also a Commonwealth country with publicly funded medical care and therefore could be considered a fair example of what nationalization might look like in Canada. There have been numerous critiques of this system, which has resulted in parliamentary inquiries due to complaints of registrants and the public. This has resulted in the conclusion that, quote, the system is more expensive, remote, and bureaucratic than the previous state-based systems. Speaking directly to the bureaucratic concerns, the implementation of an extremely large regulatory body system, as opposed to the previously existing smaller regional ones in Australia, resulted in, quote, problems of accountability and efficient access to information and advice. Things like important guidelines have been delayed by the requirement for every health professional board within the system to be consulted, and agreements needed to be reached before the implementation of these guidelines. An example is that a guideline on bloodborne diseases, which has been under review by this system for 5 years, was not implemented at the time of this study being written in 2016. An argument by those who are pro-amalgamation is that systems and processes would be more streamlined and quicker to respond in situations such as the COVID pandemic, but this example does not appear to be the case. This is a classic sign of, quote, red tape caused by bureaucracy and has led to inefficiency. In Australia's system as well, medical qualified staff have been removed as those investigating complaints and have been replaced, leading to reduced confidence in the process by both registrants and the public. Members also have expressed concern and disappointment that they're no longer interacting with local representatives and their board members are far removed and inaccessible. The new system implementation has also resulted in increased fees for registrants of up to 50% in 1 year for some. This does not speak to efficacy, rather, again, increasing administrative costs without necessarily improving patient care. Bureaucracy. In conclusion, there are several arguments against nationalizing healthcare regulatory bodies. These systems were established in Canada to respond to local healthcare needs and should remain provincial or territorial agencies to ensure community needs are addressed. There is a real possibility of unequal representation of healthcare professionals if a national regulatory body was established, with smaller groups being forgotten or dismissed and risk of conflict between groups. Regulatory bodies, as noted, are meant to reflect the population's needs. Populations vary greatly across Canada, and therefore so should their healthcare priorities. Regulatory bodies must remain regional to ensure that they can recognize and address these priorities. Australia has moved from a region-based to a national-based healthcare regulatory body, and there are real criticisms of the implementation and function of this national body, which may result in similar problems here in Canada. Thank you in advance to Shanna for her project presenting the pro side of this argument, and I look forward to the discussion regarding the topic this week.